The Honourable House Leader for the New Democratic Party.
Mr. Speaker, my question is for the Minister of Health and Wellness. Yesterday, the situation at the Dartmouth General Hospital reached a crisis level, and not for the first time. There were 23 patients without beds. 15 of them were in the emergency department, completely blocking flow to emergency care. 5 were in overflow areas, and 3 were being treated in the family lounges. People waited hours for triage. Elective surgeries were cancelled. The Dartmouth General is constantly beyond capacity and needs assistance from the NSHA and the Central Zone. The waiting room is full of people without doctors. There are no beds available for the critically ill. They are filled with patients waiting for placement in a nursing home or transfer to Halifax. Mr. Speaker, while we know that investments are being made for orthopaedics and other things in the Dartmouth General, none of that is going to stem this problem. Can the minister tell the House what the NSHA is doing now to alleviate the pressure on the Dartmouth General?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member would be aware, work, as we talked about yesterday, I believe there are questions attaching people to primary care physicians and providing primary care services is one means to improve access to care and reduce pressures on our emergency departments. That work is underway across the province, including Dartmouth. I've previously mentioned through the immigration stream, Mr. Speaker, we've had 5 family physicians commence work in the Dartmouth area, Mr. Speaker. Each of them, Mr. Speaker, that have been here since the fall are taking on full patient loads, because these are individuals, Mr. Speaker, that have several years of experience and are able to ramp up their practices very quickly. So we are, Mr. Speaker, taking the concerns seriously, and we are working to attach more people in Dartmouth and across the province to primary care services.
The Honourable House Leader for the New Democratic Party.
Mr. Speaker, with all due respect, 5 new family doctors in downtown Dartmouth is great. Our office have referred lots of people to them. It's a drop in the bucket for what we need, and it's not what I'm asking about. I'm asking about the Dartmouth General Hospital. Doctors and nurses at the Dartmouth General have been ingenious when it comes to solving problems. We've heard about it from the minister. We've heard about it in this House. They established an offload program to actually help ambulances get back on the road way before we've solved that in other facilities. Now that program is being expanded. They've had to do it. With a catchment of over 130,000 people. 130,000 people. That's the number of people on Cape Breton Island. They're one of the largest hospitals in the province. They cannot continue to operate with 25% of their beds full of patients waiting for transfer and no added resources. Mr. Speaker, will the minister commit to finding a solution for the seniors stranded at the Dartmouth General who need long-term care and the people waiting in the emergency room?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member would know, the infrastructure investments that are being made for the central region, the system took a broad look at this, Mr. Speaker, to identify what the long-term needs of the system for infrastructure are going to be. That plan, Mr. Speaker, was released. It identified additional beds throughout the system. Dartmouth General, as the member noted very clearly, is receiving many upgrades and expansions to services within that facility. Other aspects, Mr. Speaker, are being added to other locations. The new clinic, Mr. Speaker, expansions and the redevelopment here in Metro. But, Mr. Speaker, this is all part of the work that we recognize needs to be done to bring the system into modern state, Mr. Speaker, and provide the infrastructure for those clinicians to provide the care that all Nova Scotians require.